What is up, you unhealthy people? I'm Ryan and I live in Cambodia. I make videos so you can see what it's like to live in the Kingdom of Wonder. I'm collaborating with Safety Wing Insurance on this video. More on them shortly. But first, this just in.
The main problem in living here is quality of healthcare. Do they have decent hospitals now?
Thank you, ubiquitous Diabolos. An excellent question. This is a comment from a video I did about retiring in Cambodia. People are concerned.
I'm old and I'm concerned about stubbing my toe and whether the doctors in Cambodia will be able to reattach my leg if that happens.
It doesn't matter how old you are or what state of decomposition you are in, healthcare is an important factor to consider when moving to a new country.
Cambodia can be a dangerous place. Serious accidents are more likely to occur here. There are less safety regulations. Tropical diseases, those are a thing, right? The roads can be confusing and chaotic. Mosquitoes here. They are secretly injecting us with their mosquito aids. Or something, I'm not really sure what it is. But it's not cool, man. It's not cool. We don't want your syndromes. The extreme heat, the pollution, the cheap alcohol. These are all things that could take you down in Cambodia.
So today I want to go over some of my experiences with the healthcare system here in Cambodia. Get cozy, maybe pop a little popcorn, and let me tell you the story of a rash I had on my stomach. I believe this was the first time I went to a doctor in Cambodia, and I went to a small little clinic, a Malaysian doctor with excellent English and excellent bedside manner. He had a look at my rash and he determined that it was something gross. I don't remember. It's probably gross though. He wrote a prescription for me, and as I was about to head out the door, he warned me.
Be careful of the other doctors in Cambodia, Ryan. They want to sell medicines, surgeries, tests you don't need.
Weeks later, my rash cleared up, but the doctor's parting advice stuck around. When you talk to long-term expats about healthcare in Cambodia, they will tell you if you need any kind of surgery, go to Thailand, go to Vietnam, go to Malaysia. Don't do it here. But this isn't always feasible. What if I just want a tummy tuck? I gotta go all the way to Thailand just to get this tummy a little tucked. I had to know more about healthcare in Cambodia, so I injected myself with, what's that? Is that a bird? Is it a plane? No, I think I was right the first time. I think it's a bird. Wait, no, that's a weird bird humanoid hybrid like the one I saw on the Safety Wing Insurance website. If you're a digital nomad or a remote worker and you need a global health insurance plan, I'm here to scratch that itch. Whoa, I'm not scratching that. No, I believe that is candidiasis and you're gonna wanna go get that checked out by a doctor. And with Safety Wing's Nomad Health Plan, it'll be a breeze. You can get treated by any licensed medical professional, whether they work in a clinic or a hospital, whether it's public or private, it don't matter. They cover over 175 countries, so it's perfect for digital nomads like me? I don't know, am I a digital nomad? Back when I started traveling the world and working at the same time, they didn't have the term digital nomad. We were just homeless people with computers. Back then, it was also really hard to find insurance that was flexible, insurance that would allow me to spontaneously travel to a different country and not have to be worried about being covered. Safety Wing's Nomad Health was the peace of mind that I needed back then. And check this out. I don't know if they want me to tell you about this, but I'm gonna do it anyway. If a giant bird-human hybrid swoops down and carries me off, you'll know why. You can claim up to $60 per visit and have up to 10 visits per year to things like massage therapy, chiropractors, osteopathers, the one with the needles that jam needles in you, needle paths, acupuncture. Trust me, here in Cambodia, that $60 is gonna get you some pretty amazing service. So check for a link in the description below or scan the QR code on the screen and get more information about this fully equipped global health insurance plan. All right, now where was I?
I had to know more about healthcare in Cambodia, so I injected myself with...
No, what I said was I wanted to know more about the clinics and hospitals here in Cambodia. So I went into one and got a full checkup. I got a package deal where they basically test everything: body composition analysis, blood work, lipids, diabetes, kidney, liver, thyroid, urine analysis, stool analysis.
Okay, now we're going to have you go into that room, take a dump, and put some of it on this stick.
Yeah, that one was fun. They also did some cardiac screenings and radiology tests. Honestly, I don't know what half this stuff is, but I definitely do know that stool is poop. The cost of it was 110 USD, which I think is a pretty good deal. I mean, how much would it cost in America? Let me know in the comments below. In Canada, well, they would tell you it's free. It's not really free. We just say that to make Americans feel bad. Shh. So Cambodia is inexpensive when it comes to healthcare, but what about that doctor's warning?
Medicines, surgeries, tests you don't need.
Well, did I mention that I just went into the clinic because I had some weird thing with my eye? My eye was looking kind of weird. I just want to look at it and just be like,
Oh, don't worry, that's not a weird eye.
The doctor kind of talked me into a full checkup. I mean, I was probably due for one, but do you really need me to poo on a stick for this? I ended up going back to that clinic when I had a cold I couldn't shake. I had been sick for like a week and we were set to travel and I just wanted to make sure I'd be healthy for this vacation. The doctor pretty much immediately said,
It's probably just a cold.
but he wanted to do some tests. And after the test, he determined,
It's probably just a cold.
I think in Canada, in my limited experience, I doubt that they would have blood work done in this situation. So the diagnosis, a cold. The remedy, the doctor wrote me a prescription for vitamin C tablets and some strong antihistamines, 10 days worth. Is that over-prescribing medication? Well, I'm not a doctor. Do I look like a doctor? No, I look like a hipster Skeletor. He actually also wanted to sell me ibuprofen, but I told him no, I don't want any more ibuprofen. I have way too much ibuprofen. Stop trying to sell me ibuprofen. The cost was $75, which I thought was kind of expensive considering I just had a cold, but at the same time, if the results would have came back and he determined that I had the lurgy, then I definitely would have been relieved that I got those tests, right? Because you want to catch the lurgy early. Now I want to be clear. That's kind of fun. Now I want to be clear, I don't think this clinic I went to is a bad clinic. I think they want to make as much money as they can off of patients, which is kind of a jerk store move. But the facility itself was modern. It was clean. The doctor seemed to know what he was talking about. He spoke English really well, and the staff was very accommodating, welcoming. They were super nice. I think a facility like that is good because they have all the equipment there. They can do the blood tests. They can do the x-rays. They can do all the stuff. And you don't have to leave. It's not going to take you multiple days. If I would have went to the Malaysian doctor who has a small little office, he would have had to send me out to some other place to get this done. And it would have been like extra days. I probably would have to come back to him to look at the results. It's a hassle. But on the other hand, because he doesn't have that equipment, he doesn't make any money off those tests. So he's probably not going to send me to get those tests done if they're unnecessary. Does that make sense? You following along here? Is that a good thing? Is it a bad thing? It's up to you. I guess. I don't know. Back when I got my full body test done, they determined that my cholesterol was slightly high. This was something I knew was coming. The men in my family love a good fatty deposit in the old blood vessel. So this was something I had to monitor every 6 months or so. So I set out to find a lab here in Phnom Penh that could do it quickly, cheaply, and easily. And that's not hard to find here. Biomed Phnom Penh has a long list of tests that they do on their website. The costs range from $1 to $200. Some of these you might even want to do for fun. Here's a question for you, a hypothetical of sorts. If you wanted to get your sperm tested, you drove a half hour to a place that does testing, but then they said, here's a container, we need the sperm in that, and they didn't let you use their bathroom to deposit the sperm. Would you drive the 30 minutes home, do it, drive the 30 minutes back, or would you go around the corner to the Amazon cafe and make the deposit in their bathroom? I mean, it's like 5 minutes and 27 seconds versus an hour and 27 seconds. It's a big difference in time. To get my cholesterol tested at Biomed is $1.50 for the HDL, $2 for the LDL, and $1 for the total cholesterol. And yeah, let's throw in a triglyceride test for $1.25. I love this place because it's so easy. You just show up, you tell them what you want, they go take your blood, they give you a little QR code, you're out in like 10 minutes. And then in the afternoon, you can scan the QR code and get your results. At the hospital I went to, I can tell you that their lipids test cost $21.75 versus Biomed's $5.75. Plus, I would probably also need a consultation with the doctor for like $20 or so, maybe some added fees, nurse fees, and all this other crap. So I find that in Cambodia, it pays to learn a little bit about your body and to not rely just on doctors because, well, one, you shouldn't always trust a doctor. And two, you can save yourself some money if you take some of these things into your own hands. Kind of like I did in that Amazon cafe bathroom. No, I'm kidding. That's just a joke. Finally, I want to tell a story that has no comedy. It's kind of the opposite of comedy. It's pretty terrible. There was a foreign teacher that worked here in Cambodia. I think this was about 5 years ago, and he had gotten into a bad motorbike accident out in the countryside, and he was unconscious on the pavement, bleeding. An ambulance was called, but the ambulance didn't want to take him because A, they weren't sure if he was going to live, and B, they didn't know if he had insurance. If he didn't have insurance and if he died, then there would be no one to pay the ambulance bill. So they left him. They left him on the street to die. And that's exactly what he did. He died in the street. Horrible story that reminds us that things aren't the same here in Cambodia as they are in maybe the country you're from. You have to be more careful. You need to have health insurance, and you need to have that health insurance card on you. The ambulance people apparently looked through his wallet to see if he had insurance. He did have insurance, but he didn't have the card on him. It's a crazy story. It's a very sad story and a pretty shocking story. And there's a lot of horror stories like that when it comes to healthcare here in Cambodia. You hear about medical facilities closing because they're not legal. You hear about people going in to get their teeth checked and ending up getting hepatitis B. It's hard for me to recognize good healthcare facilities here because I haven't been to any of them, but definitely do your research. Check Facebook groups to see what other people are saying, and don't skimp when it comes to healthcare when you're in a country like Cambodia. Someone told me that part of the problem is that all the medical textbooks here in Cambodia are in English, and they don't translate any of them into Khmer. So anybody who wants to train to be a doctor here, they have to do the whole thing in English basically, which makes it more difficult. Yeah, I don't know. That's all I can really say now, but I do plan to do more videos about healthcare here in Cambodia. I have a tour lined up with a hospital. I'm going to talk to some healthcare professionals. So stay tuned for more videos about this topic. Big thanks to Safety Wing Insurance. Check the link in the description below. And thank you to you guys for sticking around till the end of this video. I thought it'd be a lot of people unsubscribing.
I don't want to be subscribed to some rashy guy.
They don't call me Rashy Ryan because I don't have rashes. Take care, comb your hair, get that thing checked out that's on your butt. The doctors, they'll have more information about it than I can give you, so stop sending me photos of it. I'm out.
Look at my grades, don't match up, no love.